So guys, have you ever woken up and you were like looking straight in the mirror and just saying, man, let me finish. Let me finish. Am I ugly? Well, you're in luck today because today we're interviewing celebrity award-winning plastic surgeon, Dr. Michael Keys. Let's give it some noise right there.
Hey,
Yeah.
hey, everyone,
Thank
thank
you.
you guys so much for having me on. I'm super excited to talk to you guys. I'm a huge fan of what you guys are doing, and I'm excited to be here. Super excited.
That's awesome.
Thank you. Thank you for coming on. And we're excited to talk to you about all your works and stuff like that. The works that we're going to be talking about, today's topics, his journey on becoming a plastic surgeon. Then after that, we're going to talk about how plastic surgery is so lucrative in its business and industry.
The goods and bads.
Yeah, exactly. And then the dangers. Don't forget that. Yeah, you put the goods and bads. So I'm just over talking. I'm sorry. Yeah. And plus, for you gold diggers, you know how to bag a man of this caliber. Yeah, I hope you're happy.
So, Mike, what made you want to become a surgeon, plastic surgeon?
Wait, did you not want to tell them how you guys met? Shh.
It's like a top secret a little bit. No, I'm kidding. But yeah, so the reason why Mike is on the podcast is because I met him, a couple months ago now. I was working this private event, bartending, and he was one of the guests, and we kind of like connected right away. And I was intrigued by your story and your profession, and for someone who has gone through a surgery myself, I just had like a million questions to bombard him with, which he was so kind to share it with me. But I was like, you know what? Why don't we just bring it on the podcast and educate all of our audience as well? Because I'm sure there's plenty of people that either have gone through plastic surgery or want to go through plastic surgery. And I think you're like the best person to have on the podcast to share your wisdom and knowledge.
Yeah.
Well, I appreciate it. Yeah, it was crazy how we met. You know, we had the private event. It was actually the launch of vodka, 631 vodka, by my good friend DJ. He is a entrepreneur. He has a distillery here in Miami. And so it was my first time in the Hamptons. It was an all-white party, which you guys throw a lot, it sounds like.
Yep,
And,
it's big Hamptons vibe.
yeah. And so it was the same time when Michael Rubin was throwing his party up there. And so it was a great night. Paulina was a bartender. She was, serving the 631. I actually was getting it on the rocks because it was so smooth. And I think I overdid it a little bit, but it was good. It was a great night.
You didn't seem like you overdid it.
I think you did it just right, how you're supposed to be doing it right there.
Yeah, it was vacation. It was cool times. But yeah, she's super cool. And so I'm super excited to be here. You guys, I've seen your episodes and you guys keep it professional, and I'm super excited.
Keep it professional. Like, I never even got that. Okay. All right. That's nice.
Well, thanks.
With like the quality and stuff. Conversations can be a little.
I feel like Robot Chicken at that point then, just because it's just like they got a Oscar win for their animation, and they made a joke about it. Not their content, because obviously it's Robot Chicken, but I don't think you know what that is. Yeah. Mike, you know what that is, right?
Of course.
Okay.
Wow, I'm so dumb right now. Yeah. What is it? I have no idea.
Yeah, exactly. Okay. I'll show it to you later. It's hard to explain. It's a bunch of skits there.
Yeah.
Okay.
But doctor, please let us know, how'd you even get to where you are? Like what you have to do. What mountains did you have to just I'm climbing up on them, like King Kong.
Oh man, there were a lot of mountains and a lot of it's a long road, man. It's see, I'm the first doctor in my family. And so I didn't really have a lot of resources as far as like, people that have gone through the pathway and everything. And so I went to University of Florida for undergrad, did 4 years of that. And then I went to University of Miami for med school. And then after that, I did a 5-year general surgery residency and then a 3-year plastic surgery fellowship at Louisville. And so super long road. I've only been out for a couple years, but I've been able to build a brand primarily through social media. And that's helped me so much as far as building my clientele, making networking opportunities, and then also just working with like devices and stuff. And so it's been super beneficial, but definitely a long road, very, very long road.
So what made you like want to become a plastic surgeon?
So when I was in med school, I didn't know what I wanted to be. And so our third year of med school is when we really like rotate through the different specialties. And so when I got there, each med student typically decides like a broad pathway, either through medicine or surgery, right? And it's just two different ways to approach, treating illness. And so medical people, they're more cerebral. They think about problems. They go on long rounds and dressed in a tie and everything. And so I'm more like the hands-on. I like to be like instant results that come with surgery and just kind of being the king of my domain in the operating room. And so that really attracted me. And then within the field of surgery, I rotated through plastics, and that's when I fell in love because, you get to do work on all ages, from kids all the way up to elderly. You really help restore people's confidence. And it's just very like artistic, every incision that I make, the patient also sees, right? And so when I was in general surgery, like we could do a crazy like gallbladder surgery or something, right? But no one would know, right? They don't know if you really hit a home run inside or if you completely screwed it up on the inside. No one would really know unless they went back inside. But with plastics, the patients see everything that we do because they see our incisions and obviously the final result. And so it's kind of cool because I give people confidence, but it's kind of trippy because like I have to make a cut on them, like a long lasting scar in order to give them that confidence, right? And so I always take what I do seriously, and like I really appreciate the patient's trust in what I do because I just understand that whatever I do is going to be permanent on them. And so I always try to hit a home run.
Love that.
Yeah, damn. Now, what kind of, I guess, like specialized surgeries do you like do regularly?
Like, what are you best at out of all plastic surgeries that you perform?
Because I'm looking for a BBL, so
Oh yeah, you want to be a BBL drizzy?
Yeah, all day.
We can make it happen. I've actually done BBLs.
I've been walking around like Paulina.
Calm down. I did not get BBL.
That was actually a conversation me and Paulina had. Actually,
you were just like, can you spot like BBLs like just off the rip, just like, oh no, she definitely got BBL.
Really poorly done BBLs, I can tell off the rip, and I think most people can tell. One of the biggest signs is when their ass doesn't match their thighs, right? And it's just like a really round, or
I saw one
their
yesterday.
hips
I was
are
like,
really round. Yeah, and so those are telltale signs, but a really good BBL shouldn't be really noticeable. Like if it's tastefully done and it's more of a petite BBL where you're just like adding to what already exists and not trying to like construct this new thing. And so I try to do work that kind of reflects that. Obviously, if a patient wants a particular look, I will accommodate as long as I feel that it's appropriate for them. But those are all discussions that we always have in consultation.
Okay, so that brings an interesting topic right there that I want to discuss with you. Is just where is the line when it comes down to just somebody that it's just like, yo, you're good where you are. You don't need this surgery for whatever. Like you need therapy. That's what you need, like more than anything.
Yeah.
As a doctor, you could probably say that.
Yeah. So
absolutely. So, one of the statistics they quote when we're in training is that, for example, specifically for noses, up to 30% of patients may have a disorder called body dysmorphia, or basically they have this intense preoccupation with a perceived flaw about their appearance. So that's just a fancy way to say that you're just obsessed with something that you perceive as wrong with you. And so a great example in pop culture is Michael Jackson, right? He underwent trauma as a child. He was raised and, went through an abusive situation, obviously super successful because of it, maybe, but like he went through some traumas and was preoccupied with his nose because his father used to call him the big nose and blah, 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 blah. And so as he got older, had access to wealth and stuff, he went to plastic surgeons in order to get multiple rhinoplasties or nose jobs, to the point where his nose had no structure left. He actually had collapse of his cartilage. He had a saddle nose deformity. And then that's why he looked deformed towards the end of his career, end of his life. And so, unfortunately, in our field, we really have to try to screen those patients out because they can cause more issues for you down the road, right? Mm-hmm. Because if I look at someone and I'm like, your nose looks perfect, there's nothing that I could do to make it better, then that's a situation where, there's a disconnect with what the patient wants and what I can provide. And if I'm not, upfront with that to the patient, then they will be set up for disappointment. There could be cause for unhappy. Yeah. And so, you really try to assess. And I've definitely canceled cases because of patients who just didn't have realistic expectations. So
now here's another question. Why does at least for me, like every plastic surgery like that, a woman sort of like, and not every woman, but like most women end up looking like Kim Kardashian? Is there like the
it's a trend? Are you trying to look for trends?
Yeah, is it a trend or is it like that's the facial structure that's most pleasing to most people? Where at that point it's just like this is sort of like what everybody ends up if they keep going plastic surgery after a while.
Yeah. That's a great question. And so, number one, Kim Kardashian is very influential, right? Mm-hmm. She's one of the biggest people on social media. So people want to follow whatever she's doing. And so whatever plastic surgeon she's going to, I know a few of them, they deliver a certain type of result and then they get referrals. And so they deliver the same type of results amongst that community. And so then the rest of society wants to follow what the celebrities are doing and so forth, right? So that's one. Number two, as far as like what is aesthetically pleasing, that varies depending on culture, right? And so like if you look at East Asians, what they perceive as beautiful versus what Americans perceive as beautiful is completely different. Like women in East Asia, they appreciate very feminizing features, very like narrow jaws. They don't like the very angular jaws that like the Kardashians have popularized with like the fillers and so forth. And so big difference, even with the skin, they really like the East Asians, like really pale porcelain skin and so forth. Like Paulina would be a hit over in Asia or Japan if she visited. They would be like, oh my gosh, pale with.
Don't give her more ego, Josh.
I got tan. Damn, am I that pale?
No, you're not that pale, but you know what I mean. Like they just really appreciate like Caucasian skin or that type of complexion versus like, in the States, like tanning is, it used to be more popular, but like tanning is popular, tanners and stuff. And so all of that is cultural. But as far as like the ratio, there are golden ratios that you can look up where there is an ideal aesthetic. And that is what plastic surgeons are trained on. Like the rule of thirds, like you should have, equal proportions based on the thirds. And then there's like a rule of fifths. And so there are different proportions that we want to try to match. So
interesting.
Like mine. Yeah. And my perfect nose. Yeah.
Yeah, there you go.
I've actually, I'm not going to lie, I've thought about rhinoplastic surgery. I don't know how.
Really?
People ask me sometimes if I got my nose done.
Really?
That's a great compliment I'll take it.
Yeah, you definitely got a good nose.
You got a little nosy nose.
I just like my nose because when I eat a girl out, I just like, it's just like, it's like plug and play, baby.
It's another tool. Yeah, there you go.
That's it. I'm not sure if you ever see the Workaholics where he had like a chin dildo strap on his face. I was like, just the more plugs, baby. That's
so in Europe, when you have declining, is that the word, like hairline? When you have like, what are those?
Receding hairline?
Yeah, but both like on the sides though, like
male pattern baldness.
Yeah, so they say that you dive too much. That's why your hairline is coming back.
I don't know. Mine is still on me, so they got something else right there. But Doc, I also wanted to ask is just for a fun little game right here. What if just looking at my face, what would you say I would need to get that perfect golden ratio?
So that is a great question. And what I always tell people is that I shouldn't be the person telling you what you need. You should come
Ooh.
to me and say,
This is what I
what
want.
do I feel like I need some, I feel like this is making me uncomfortable or like I want some more confidence, etc. Then I could talk to you about what I can offer. Because what can be an issue is that if someone comes to me that has, for example, body dysmorphia or
Mm-hmm.
something, right? They're obsessed with something and they're like, Doc, like I need something done, like what would you recommend? I'm like, oh duh, your nose is the problem.
Now you're in your
Then
head for the rest
I'm
of your
like
life.
perpetuating this
Mm-hmm.
like complex about their body feature,
Mm-hmm.
and it comes from a source of authority, right? And so then that just accelerates that issue. And so I always have patients come to me with what they feel like, hey, like, do you think I should do something here? Like, do you think? And it's like, yeah, sure, I can offer you this if that's what you want, but I have to be very careful in that
With your
aspect. So,
wording, yeah. I even remember
yeah.
going for my plastic surgery,
Mm-hmm.
and like the doc was like, "Let me see what you got," and I was like, "All right." So I just remember taking my clothes off, and he's like, "Well, these are nice," and I'm like, "That's great." He's like, "But I can make them better." I was like, "I appreciate you. This is why I'm here," you know. But if he looked at me
Yeah,
like, "What the hell is this? You definitely need help," I would probably
yeah,
be
yeah.
scarred for life. I don't know. Even though I got a whole new breasts, but I don't know. I wouldn't appreciate a doctor to like just tell me, "Oh my God, this is terrible." Like I'm glad you came in here to fix,
Why didn't you come yesterday? Geez, like it's so bad. No,
Yeah.
I actually, through the course of training I've been through with a lot of different plastic surgeons and seeing how they do things. And there are plastic surgeons out there that will just kind of put the seed in people's heads and just like, oh, like, are you sure you just don't want to add your ears on top of like your nose while we're there? Like, and
That is
so,
crazy.
from a business standpoint, like, does that make sense? Like, yes, potentially, but like you're like upselling the patient, but ethically it's not there, And so,
Mm-hmm.
always we have to maintain our ethics whenever we're doing things. And so that's not my approach to things. But there are different ways that doctors kind of bring up what needs to be done.
So let me ask you this. What has been a patient that sort of like fulfilled, you as a doctor to be like, I'm so happy that I went through everything and I helped this person and just be like, I made them feel that confidence that you spoke about earlier.
I'll give you an example of a patient I did recently. So there was a patient who actually had breast cancer at one point, and she
Mm.
had breast reconstruction. She had a mastectomy where they take off the cancerous breast tissue. And then they go through a reconstruction phase where we typically put a expandable implant that we can use, like a tissue expander,
Hmm.
that will hold the breast skin, kind of it stretches out the skin, so eventually we can accommodate an implant that feels more
Wow.
natural. And so this patient had that work done in another country and then had multiple revision surgeries because of issues with, their
Mm.
breasts and stuff. And so she came to me and she had been turned down by 5 different surgeons. And I looked at her, and I was trained by some of the best doctors,
Hmm.
like world renowned, kind of wrote the textbook on breast reconstruction and breast
Yeah.
surgery. And so felt like I could offer her a better result. And so we got it done. And she's super happy. Like, it's always fulfilling whenever the patient comes back and is like in tears and very like appreciative of
Mm.
like helping me give their confidence back. So
I love
um,
that.
those are very fulfilling. It's whenever the patient just kind of, I love to see them if they add me on like social media or something and they're posting themselves like going out in a new dress and they start,
Oh.
showing off their bodies and stuff. It's always cool to be like, yeah, I was involved in that, and so I love it. I love it.
Yeah, so now that we got into like the love of sort of like of that, like let me talk to you about basically how you expanded your business and grew your business. And you mentioned social media and obviously like people just tagging you and stuff like that. Like how long of a road was that to build to almost 100K following? And obviously like, you know, all the other things that you've started to achieve. Was it a slow rise or was it just something like, oh, I got one celebrity and then they were like, they mentioned it like wildfire. And then it was like titties every day. Just like, you know.
Yeah. So I was kind of in a unique situation because I started my social media presence really when I was in training, right?
Hmm.
And so my thought process was that now that I matched into plastic surgery, like, and I want to go into aesthetics, I know that marketing is super important to do, and that with social media, that's the natural evolution of how plastic surgeons will market. And so I was like, why am I going to start my branding or start my, building my reputation after I'm done with training when I'm going to be going through the process of like starting a business and all of these other things. If I can start the process while I'm in training and let kind of planting the seed and letting it grow,
Hmm.
then I thought that it would help me kind of hit the ground running. And so that's what I did. Initially, I started to post like what I felt other plastic surgeons did a great job, like a great result, and then just kind of like my comments on that. And then I started to talk about celebrities and what I thought that they've had done before and afters and stuff.
I've seen that from you. I researched that part,
I like
and
that.
yeah, and I
Uh,
really like the one about Brad Pitt because it was
oh
just
yeah.
like it was so well done overall. Like you wouldn't expect. Like
Uh,
honestly, like sometimes I don't know who has had surgery, so for you
mhm,
to be like, oh yeah, he has them, and it was so subtle, but it like really
mhm.
showed results, you know,
Yes.
and it made me
Yes.
just think about like is the older generation getting more done, or is it the younger generation that's getting more plastic surgery? And I guess I pass that question to you.
Yeah, so the trend is, if you look at the statistics, the Aesthetic Society published, or rather, I'm sorry, the American Society of Plastic Surgeons, they publish a procedural data report every single year, kind of talking about the numbers of procedures. These are all tracked. And so, like, what procedures are going up, what procedures are going down, and plastic surgery as a whole is trending upwards. It's
Mm.
never taken a hit. It's always been trending in the upward direction. And the reason for that, I think, is that almost similar to you, a lot of people just don't realize that people are having work done, right?
Yeah.
Because it looks really good and, it's very subtle sometimes. And they're able to hide any downtime and stuff like that. And so I think as social media has kind of propagated plastic surgery, has become very popularized as well as destigmatized because there was a stigma associated with plastics where people would lie about it, for example, and say, "Oh yeah, my face, I never had a facelift. Like all those wrinkles just disappeared. Like I would never touch my face with a scalpel, right? It's just
Hmm.
Botox." And it's like, come on, like now you had a facelift. Like, come on, let's be real.
Yeah.
And there are still some people that will still deny plastic surgery, but I think a lot of the younger generation, the Gen Zs and stuff, are very honest and open about everything. I mean, they show themselves like fresh out of bed and stuff, and are cool with it. But even applying to like plastic surgery and what work they've had done, and that enables other people to have access and to be more knowledgeable about things. So it's benefited my industry for sure.
Mm.
We searched like that what did you find that the plastic surgery
Oh,
industry
it's
is
going for
expected to be worth 75
yeah
billion by
from going
2030,
from
going from 55.
2022 50 billion, and then 2030 it's going to be 75 billion. It's
That's
going to
insane.
increase, you
Almost
know.
double.
Yeah.
Yeah.
So do you think it's just a rise also of social media imperfection with people in that sense of just like is there a point where it's just like you said about body dysmorphia, are we creating a society that's sort of just prone to like, I need my face to be perfect. I need to be perfect.
It comes with comparison, and social media definitely has a lot of impact on that. I can speak as a woman. You know, we tend to compare ourselves to other people, but you really just need to understand that 99% of social media is not real. There's only a few people that I know on there that are very authentic with what they do. So you just have to have a smarter, how do I say it? Just like take social media with like, what's the word? Yeah, the grain of salt. Thank you, English. Today is a struggle. Because, you know, looking at Kim K all the time, I would want to look like her too. You know what I mean? Like, it's just like what you watch, what you see, who you surround yourself with. This is like automatically what you want to look like, who you want to be around. So, well, I'm going to have you answer that question, though, because you're big on social media. Sorry. Let me say something. Hello. You've been talking for fucking 20 minutes. I'm going to say this shit
right here, right now. Paulina's been saying to me this entire time, I don't want to talk. You guys can talk. I don't want to say anything. Please take over.
Geez.
And then the moment that Nope. She of course carries forward.
Goodness.
I twitch.
Maybe they should name it the D&P podcast. Huh?
Yeah, maybe we should make a switch. Shit.
Yeah. Maybe. No, I'm kidding. No. Okay, I like it. It's all about Paulina.
To answer your question, so listen, social media definitely propagates people wanting to get plastic surgery because of not only accessibility, like people talking about it, but because people want to look like their favorite influencer or celebrity. And then not to mention like the filters, right? Like suddenly you put on a filter and you're like, wow, I look way better with this filter on. And like, how do I look like this? And sometimes it's not realistic because anytime they're like reducing like your jaw, you know, structure, that's a lot of surgery to do that. And so it's not realistic for a lot of people, especially with the downtime associated with that. But here we are with the land of filters and everyone looks perfect and wants to kind of emulate that. And so are we creating a society where there is body dysmorphia? Potentially. I mean, body dysmorphia is specific more for like an intense preoccupation with one part of your body. But I think maybe there's lesser degrees where you're just not as confident because like, oh, my jawline doesn't look like that guy's, or like, oh, you know, my nose isn't as cute as this girl's and stuff. And so, yeah, there are definite people that get plastic surgery for the wrong reasons, in my opinion. You know, I think that patients should get plastic surgery when they really feel that whatever change they're going to have is going to make them more confident, because confidence is what like the gift that I can give, right? And so confidence will allow you to walk into the room and kind of secure like, okay, like I'm here, like my presence is here, or like confidence will kind of make you speak better, or maybe take the risk and
to
kind
go
of
talk
speak
to
up
that
more.
girl.
Yeah, exactly.
Get that job.
And that will lead you on the path of success, right? In my opinion, I think that confidence is just one of those skills that very successful people tend to have, because you know they just can kind of get people to do what they want and stuff. And I do think that good looks is a currency, right?
That's a clip right there. Okay.
It really is. I fully agree with that.
Ooh, that's why you get all the money, huh? Okay.
I can get away with a lot of things. But you know what? I'll tell you, it is exhausting sometimes to
be that pretty. Yeah.
No. Oh my God. You know, I don't think that highly of myself, but
well, you should. There you go.
I don't really like to be center of attention. And typically when I walk into the room, I am. I don't know what it is. I guess it's just like multiple. Yeah. I hope that would be the energy answer. It's probably not.
No, it's part of it.
No, it's part of it. Yeah, for sure. Yeah. You got a confidence to you. And
exactly.
I think
but with confidence, right? Speaking of confidence, I do, but I've worked on my confidence from the inside out. Like, I think that, you know, getting your boobs done, getting BBL, it will give you confidence for a little bit until something else shows up that you don't like. And then one of my best friends, oops, sorry.
It's okay, it happens.
One of my best friends, she has gotten through a BBL, multiple breast surgeries to get them bigger. She got her nose done. She got I probably
Jesus
don't even know about
Christ.
half the shit she did. You know her, by the
Yeah,
way.
yeah, yeah.
But yeah, so and to me, she's always been gorgeous. And I think she is that type of patient that like is never going to be happy with the results. And she was always going to find more and more. And even now when she posts her pictures, I still see her editing her face. And I'm like, you spent so much money on your nose, on your lips, on, the whole face. Like I'm pretty sure she did her cheeks too. And you're still not happy. So I think the confidence partially has to do with your looks, but like for me, specifically with my breasts, like, am I more confident? Am I like, if I look at myself naked, I'm proud of how I look 100%, but that doesn't make me
Love it for you. I love it for you. Yeah.
but that doesn't make me fully confident because I still feel shy in certain situations, just as much as I was shy when I didn't have, D cup.
You have D cups?
Yeah.
Wow.
Yeah.
You don't look,
No.
enough, which is good. I have a jacket on.
Like, trying to cover up
Yeah.
now.
Yeah. That's how well I know breasts, Yeah.
But I do think that confidence, has to do with both the looks and what your mentality is and acceptance of yourself. And also
Absolutely.
realizing that nothing and no one is perfect. So just accept yourself for who you are, and instead of looking for perfectionism and instead of looking for being perfect, just be grateful for what you have, because for all I know, you could be born with no arms. You know what I mean? Like there's worst thing that could have happened to you. So I think it's
I just hope that person that's watching this podcast with no arms is like, that bitch.
I'm sorry. I'm just saying, like, be grateful for.
Like, turn this off.
But you know what? I know a girl with. Oh my god. I know a girl with a. Jesus, I can't speak English today, and this is so bad. With like
I
a.
wonder why.
Dirty, I'm gonna kill you.
Yeah.
I had a rough weekend, guys.
She was out drinking.
No, she had like a robotic arm, and it happened to her. She pretty much got T-boned by another car, and her arm got stuck in the car door, and it got smushed. Like literally, it was the arm was done. There was no saving her.
Ouch.
So
no saving the arm.
Yeah,
Yeah.
the arm. Sorry.
Yeah.
She's well.
Yeah.
But she has gone through crazy depression and mental issues, because from being totally fine, now she has no arm and had to go through a million fundraisers to even like collect the money and be able to have that robotic arm. So it was such an adjustment to her. But I remember talking to her, she went from super confident to like, I don't even want to live anymore, So she had to work through that pain and go through some personal development and growth in order to see herself beautiful again and accept for herself for the new her, with the new arm. So,
Doc, this is just an outside question. Maybe you can answer it, but I'm not sure. Why is prosthetics so expensive? Like they're like 30 grand or some shit. I remember reading. I was like, Jesus Christ, these people can't, they're crippled and we can't give them a leg. Like,
Yeah, so I'll touch on a couple of things. So back to what Poe was talking about, as far as like a friend who went through the amputation and had to get reconstruction and stuff. So a lot of that is actually done with plastic surgery, right? And so during my training, I did a ton of reconstruction. We used to do amputations or even reattachment of like hands and stuff. And so plastics is not just aesthetics and like cosmetics and stuff. It's also reconstruction and restoring function. Restoring function is like the purpose of reconstructive surgery. And so that in itself can also give a patient confidence, right? And so I'm sure she's a lot better with her robotic arm than she was after her, accident and stuff. And then she can start the path to getting her confidence back, which may take therapy and physical therapy and all those kinds of things. Now, back to what you were saying there, Elise, is as far as the prosthetics, the reason why they can be super expensive is because there's a lot of research and development that goes into creating these prosthetic devices. And so a lot of times whenever a company comes out with like a new medication or something like that, the costs are passed down in order for them to make back their money. They're passed downstream to the patient because sometimes it takes years and years of research where they're not making any money, right? Think about it. If you're in the process of creating the best prosthetic device, that takes, hours and hours and hours of highly paid engineers and scientists or whatever to come up with. And then finally they come up with this, epic device, then they have to sell it at a premium in order to make some profits. And so that's the reason why it can be super expensive. Another reason why it's super expensive is because the companies can know that they're going to get reimbursed by the government. So like if it's covered by insurance, which a lot of times, depending on the insurance policy, they are covered, they're guaranteed to get their money. And so, they can charge a high sticker price. And that's one of the reasons why medications and devices are so expensive in the States compared to other countries, is because, companies know that they can inflate their prices and get reimbursed, guaranteed by the government.
Now, I sort of heard this from Dr. Mike. I'm different Dr. Mike.
Yeah.
I think you know who I'm talking about. White dude, glasses, all that good stuff. And he was talking about how insurance and companies in that sense is what drives up the price, like you were just mentioning, versus what you doctors actually get paid, where yes, you make profit, but you also have to pay for schooling and everything else, which is not cheap at all. And then you have to hire these administrators to just you just call this number because this insurance, I don't know what to file in it. And it's and they're going to give you another number, and it's just going to take up your entire day just to get through one person versus what I guess it used to be, which I'm not even sure what it was anymore. But, and I'm just wondering if there's going to be a better way in the future, or do you foresee anything like that would help people?
So in my industry, in the world of cosmetics and private pay, I don't accept insurance, but obviously a lot of my colleagues do, and just the vast majority of people in medicine take insurance. And so insurance is definitely an issue, and it all goes back to how Medicare or the government-sponsored insurance plans are kind of set the way that other insurance policies follow. And so every year or every Congress session, they always talk about changes to Medicare, and then that affects how private insurance is carried out. And so, reimbursement, can really determine whether a doctor does a certain type of procedure or chooses to go a certain route with their care. And so that unfortunately puts us in a hard place where sometimes we want to advocate for our patients and do a procedure that may not be covered under the insurance requirements, but it's still benefiting the patient. And so for us, we took an oath to try to really help our patients. And so we will advocate and call the insurance policy and see if we can get ways that we can push it through. But sometimes we get denied. And then it becomes an issue where you really believe a treatment is going to help the patient, but then they can't get it because they can't afford it. So then what do you do, right? And so that does put us in a hard place, and we should always advocate that insurance policies shouldn't dictate what the doctor recommends, because ultimately that will affect, our healthcare rates, and kind of that's one reason why America has super high costs, but our outcomes aren't the best in the world. You know what I mean? There's other countries that have better outcomes, even though they spend a lot less on healthcare. Obviously, that relates to the population and stuff. But still, per capita, even if we adjust for all of that, our outcomes are not the best of the best of the best, as you would expect it to be, right? So,
damn. Well, that's knowledgeable. I would like to ask your political view on things, but we're going to keep this, fun. So let's go to...
With that, I got to go, guys. It was nice talking to you.
Yeah, smart man. Yeah. I actually thought he was about to leave, honestly. I was like, oh, shit. You didn't even finish it. I want to switch over to a little bit about yourself though, and your living, with everything mentioned, because you're out in Miami, correct?
Yes, I am.
Yeah,
I
that's
am out in Miami.
yeah.
I'm back. Like I went to med school here and just really fell in love with the city.
Mhm.
I think a lot of other people are falling in love. A lot of New Yorkers are moving down here in
Of course.
droves and driving all the prices up, and real estate's going crazy and stuff. But we're adjusting. It's all good. But yeah, I love the city. It's just beautiful. The weather's nice.
Mhm.
The people are healthy. They take care of themselves. Beauty's kind of represented here, and it's just a great place to be, I think.
Now, is that like competition with Cali as far as just like, especially like their pricing and everything else is shit from what I hear. And now I feel like Miami is now like the new city. I mean, for pornos, one, and then two, just like like you said, aesthetics is like a currency up there, down there. It's just like like
Yeah.
your beauty really helps you to move along. Because I've been to Miami. Unfortunately, one of the things I did not like is like, sort of like the look rich mentality of just like, let me rent out some Lambos or like a yacht. Let me look like, popping bottles, all
Yeah.
that shit clanking, and like just
Yeah.
that craziness. And it's
Yeah.
just like, but sort of like
So people are not authentic to who
not
they
some
are.
A
people, a
lot of
lot of
people
people.
aren't. No.
Yeah. Like
Yeah.
it's
Yeah.
just
A
like,
lot of
that's
people
my
aren't.
brother's from New York, obviously, and he went down there and it's just like, if I could just like get everything from New York, especially the bagels, it's just like
The
down
bagels,
here,
yes.
and just the authentic attitude, because he just hates sort of that mentality that they have down there, where it's just like, it's you gotta
Like a
show.
show off, yeah.
Yeah, you just gotta show up
I would
and
hate that personally
yeah.
because I see as much as I'm from Poland and I obviously have a lot of European mentality in me, I became a New Yorker and I'll call you out on your bullshit every single time. So I feel like people would start hating me in Miami. I'll be like, "You're a fake for this, and that." And yeah, I can see what you mean with like people go there to like
Yeah.
just show off and flash. But I'm sure you've experienced normal people there. I mean, you seem like you're happy where you are, and you and I have had discussions about Miami, and because I was considering
Were
moving
you
to Florida.
originally from Miami? Just to ask.
No, I grew up in Gainesville, where the University of Florida is at, and
Oh.
so, but I went here for med school, and then that's when I really fell in love with the city. And yeah, I think the touristy like stereotype is like the guy who comes and rents a yacht, or I'm sorry, rents like a Lambo or something, and then goes to the club, valets it, and then like picks up a girl, and then goes back to like some crappy Airbnb, right? Like it's a
Yeah.
disconnect between having a Lambo and then you're not really living that lifestyle.
Hmm.
But I think a lot of people, especially now, they actually truly have wealth, and so
Mm.
Miami, the socioeconomics is changing. The local population is actually getting forced out of the city because of rising rent prices and inflation and so forth, and it's just become very expensive. And
Yeah.
so people truly have wealth here, and that is one of the reasons why we decided to open up Celebrity Plastics in Miami, is because, to be honest, to go back to something you mentioned earlier,
Hmm.
is that Miami, in the world of plastic surgery, was actually known more for high volume, low pricing models. And those
Mm.
are what people may call like chop shops,
Yeah.
where yeah,
I can
where
see
you have these
it.
practices that you're just like a ticket. Like you come into these massive waiting rooms and there's like 20 people there, and they're doing 30 surgeries a
Oh
day,
my god.
and then just offering
Well,
rock
just
bottom
for
pricing.
perspective, how many surgeries are you regularly? Because 30 to me is just like, I guess that's a lot, but what's a
A
regular amount?
Yeah,
day?
Again, I don't know.
yeah,
What
a
do you?
day.
Yeah, what do you do? Like,
Yes. So, it's a typical day. Like if I'm a busy day,
yeah.
maybe 3 or 4 would
Oh
be like the
shit!
max.
See, now
You know what I
that's
mean?
perspective. It's
Yeah.
like, god damn, 10
Yeah.
times that. Oof.
Yeah.
Yeah.
Yeah. And so they cut a lot of corners because obviously the margins are very thin. They run like a restaurant where your margins are super thin, and you have to cut corners, and that's in every aspect from safety to like cutting corners with facilities, etc., in order to make a profit. Now they're very profitable because they can charge, they make up for it with the volume. But unfortunately, that leads to bad outcomes, right? And that leads to just poor results. And then the patient ultimately may spend more in the long run by having to get a revision surgery by someone who's capable of doing the surgery. And then, going through that process. But to kind of go back, so the reason why we decided to open Celebrity Plastics, we're the opposite. We're like a high luxury, more of a concierge type of practice where our costs are higher, but we really dedicate ourselves to giving the best results to our patients. They have direct access to me, my staff, 24/7, et cetera, to really deliver that experience for the patients. And I think that the people that are moving to Miami want to like appreciate that. Like they have the money. They don't want to be pulling the ticket and waiting in the waiting room. They want the privacy of, direct access to me and so forth. And so, that's been the move. And, so far it's been paying off. And a lot of those practices that I mentioned, those chop shops are kind of dying out now because of the economy being difficult, and they're not getting the volume that they used to have. And they require that volume in order to keep their business open, or else their costs become too high, and then they just, you have to shut it down. So
what about places like Colombia? Because I've always heard like that's a mecca when it comes down to plastic surgery. It's just go down there, get it for cheap and sort of like that kind of thing. Like, would you measure them? Or I know obviously there's good one, yeah, too, exactly, and bad doctors within that. But just as an average or a general, would you say that you guys have a higher caliber where not obviously your institution facility
Same thing,
business then the people over there or what would be the difference like that you would get?
So I think that there are fantastic surgeons all over the world. I think, I know them personally, right? Alfredo Hoyos is the godfather of high definition liposuction. He created it. I met him. He's a cool guy. I learned a lot from his techniques and everything. And so they do fantastic work in Colombia. The problem with traveling, and this is to any country, is that after you have the surgery is that you don't have any follow-up with your surgeon, right? Okay. And that's what the expensive part is, because when I operate on a patient, right, they pay me, right? They have to pay the whole thing before I do surgery on them. And then after surgery, whatever care that I do for them is included in that original cost. Right. And so if they're having issues or like a wound issue or something like that, then I have to get them through the process as a good doctor and then deliver the results, even if it takes some time to get there. Right. When you travel, you're sacrificing that part of your care. And so, you're saving some money. But if you have any issue, whether it's an infection, a wound complication, or even worse complications, then you're doing it remotely with no doctor supervision, right? Like your original doctor is gone. A lot of times patients can't get in touch with them and don't have the means to fly back for any issues. And so you're really sacrificing, you're doing yourself a disservice by traveling and then not getting the post-operative care. It's not easy sometimes,
These surgeries are way too serious. Surgery. Right. Not to have the follow-up. I've heard so many complications with breast augmentation, like the implant leaking or something. Like, oh my God, thank God I didn't have to go through this.
Breast leaking, like from the nipple or just from outside?
No, the implant was leaking. Like you had an internal, like...
Isn't it poisonous?
Rupture.
There you go.
No.
Oh, okay. Like the silicone isn't...
Silicone is inert. It doesn't chemically interact with anything. And so there is no, and implants are one of the most studied medical devices on the planet. because there was a memorandum back in the day where they actually banned silicone implants for a short period of time because there needed to be more research. There was some questions whether there were some illnesses associated with it. And so they've done extensive studies and they have not proved a direct causation. Now, I'm going to get flamed by a lot of people who have like what we call breast implant illness, which I think is a true type of disease or diagnosis, but I'm not sure that it's because of the device itself. Because again, they've done so many studies looking at, I mean, anything you could think of, the heavy metal content, the bacterial content, the makeup of the shells, and they've compared it to women who never had implants before, looking at their breast tissue. Like if you get a reduction, for example, you're still looking at breast tissue, right? And you're comparing it to someone who had an implant. And they found that there were no significant differences in any of those variables. And so whatever's causing this breast implant illness may be a psychosomatic kind of thing, or it's been associated with like anxiety disorders and so forth. But there's no like physiologic basis for that illness that we're aware of at this time.
Good to know.
Yeah. So now you're
My
safe.
boobs are safe.
Your boobs are safe.
Yeah.
When would you say that develops? Obviously have done my breast done 2 years ago. Would you say like you get that reaction relatively soon after the surgery when like your body rejects the implant, or can this happen years down the road?
So there is no pattern as far as like a time frame when they develop. Some people feel like it develops right away. Some people have had implants in for 20 years without experiencing any symptoms. What I will say is that the vast majority of people feel instantly better as soon as the implants are out of their system, which is also something very unusual if you think about it, that, as soon as something is out of the body, that all of their symptoms resolve. If you Google the list of symptoms for breast implant illness, you'll get a list that's a mile long, right? And so for all of those symptoms to suddenly improve immediately after surgery is very unusual, right? It's kind of like, if I break my arm and I get a rod placed in my arm or something, or a nail, it takes some time for the body to heal and recover. Or if I have some kind of mass or something, I need to get it removed. It takes some time for you to feel better, but this is something that they feel better right away.
Do you think it's I forgot the term for it, but when you think there's something wrong with you, but there really isn't, kind of thing like that?
Like a hypochondriac, or
exactly.
almost like a Munchausen syndrome.
Yeah.
I don't think so, because like I said, we can't, it's almost like the placebo effect, right?
Yeah.
The placebo effect is, you feel like you're taking something and then suddenly you feel like you're better, even though you may be getting the sugar pill instead of the actual drug that they're trying to study, right? Is the placebo effect, does that mean that, it's unethical, like to give someone a placebo if it's not really helping them, but only helping them feel better? I don't think so, right? Because in the end, we're just trying to make people feel better. And so if they feel better by having their implants removed, then I'm doing my job as a doctor, because I'm helping them feel better, even if the science doesn't necessarily support it, at least, the regular science that I'm used to. But if the patient advocates and they feel better, then it's a win-win. I'm not going to say you're not feeling what you're feeling and just discounting what they're telling me, right?
Yeah.
I have to go along with what they're telling me and understand that and try to come to a solution. And if the solution is doing a surgery to remove the implant and they feel better, then again, I'm totally happy for them.
Now, this is a little bit of a side question. With all the breasts that you've seen, is that hard for to maintain a relationship, or they'll be like, "Nah, you just going job, really, you just lying to me. You just gotta go see some titties, free strip club, So I just wondered, have you ever been in a relationship where that's been an issue? I can't see it, but it's a question.
That question gets brought up every time I'm in a relationship, or like just even,
I'm
just
pretty sure one of the questions I asked him was that too.
Yeah.
Like, was that an issue? I personally
All
wouldn't
right,
see
let
it
me
as
ask
an
him.
issue.
Do you do vaginal reconstruction surgery?
I do.
God
Actually.
damn!
I can make it tighter.
Yeah.
I can do tighter. I can make the lips look different. I can do all of it.
I actually heard of women
Yeah.
doing like they cut some of the lips.
Yeah, I mean that's pretty common.
It's called a labiaplasty.
Oh God, man.
Yeah.
Wait, so do you ever? Oh no, I should ask these questions.
Yeah, well, this is the questions that we need to ask them so people know.
Yeah, now's the time
I just want to know if you ever
you're
look at a
representing the
vagina and
people.
you're. I'm sorry. Go ahead. What were you saying?
I'm more curious
No,
with you.
No, I was just like,
you look at a vagina.
You're like, oh, I could fix this
Yeah.
and that about that. I would be like so self-conscious about it, I feel like.
Like I would say that I'm very observant, and like as part of my job, it's almost like if I almost look at people and like they're like, okay, if they were to come up to me and ask me for my opinion, like I would be like, okay, this. It's almost like an unconscious. It's almost like an unconscious thing.
No, that makes sense, but fuck.
I just imagine some lady coming up to you. What do you think about this vagina? Just like just in the middle of you're just eating in a restaurant, just like, oh fuck. Like, God damn it.
I've gotten consults everywhere. Like I've had women flash me in public and stuff, asking me stuff. So, it's
that's
not
the doctor. This is boobs. Go.
Yeah.
God damn. Oh shit. Okay.
But yeah, I never let my job affect my personal life, because what my job has shown is that do I see very attractive people, like conventionally attractive people? Yes, that's part of my job, right? But what I see is that actually all people are the same, whether you're not conventionally attractive or you're conventionally attractive. All of those people are seeing me for a reason, right? Mm-hmm. They have some issue that they want me to address that will give them more confidence. And so some of the most beautiful people are also the most insecure. And so it really, my job has really shown to me.
He's pointing at me. Okay, I'm not that
insecure.
I
know, I see.
That's you. Okay.
It's allowed me to see that, listen, we're all human, and I appreciate people, and I feel like, listen, I'm not perfect by any means myself. And so I just appreciate people who, take care of themselves. And if they want an improvement, then I'm happy to do it. But,
God damn. This has been an amazing conversation, honestly. Seriously. I've learned so much. I feel like I want to be a
plastic surgeon.
Yeah. See some titties, yo, for free. Let's go. Yeah. No. But no, it's amazing.
Have you been denied to, let's say you're talking to somebody and you tell them hey, I'm a plastic surgeon, and has a woman ever been like, oh my God, I could never date you because you see so many naked bodies? Because I find it ridiculous if that's true.
I've never had a girl tell me that she couldn't date me because I'm a plastic surgeon, but you'll be the first to know if that happens. I will call you and be like,
I just feel like a woman turning down a doctor is just like, there has to be something wrong with them at that point.
Well, but no, I mean, I get what she's asking. There are some women that are very jealous. And they don't want, their man to be looking at naked bodies all the time. But obviously that's a person that I wouldn't be compatible with, because I have to do that as part of my job. And so, I'm super professional, and I think most plastic surgeons are very professional. And, like I said, I deal with women all the time. My clientele are 90% women. And so I need to know how to talk to a woman to be comfortable and to showing me her naked body without it being creepy, right? And so, I'm able to do that. And so whenever someone gives me that access, I always take it with the utmost respect. And it's never something that I would even joke about or anything, because I need to have that type of confidence that type of rapport established with me in order for me to do my job effectively. And so,
I would be so poor at that. I would have so many thoughts. I would have say so many jokes right now, just writing them down. Like they'd be like, "What are you writing down? Don't worry about it." This is not the right profession for me.
Amongst other plastic surgeons, we may have our like locker room talk or whatever like that, but it's always just, as far as, trying to make everything better. But it's nothing inappropriate that we would ever bring up with our patients.
Of course, I can imagine that. Now, let me go into, what are you looking for in the next couple of years? I mean, since you have achieved so much in your career, I mean, it's true. It's just like, how old are you, by if you don't mind me asking?
How old do I look?
You look 25, bro.
I wish, brother. I'm 37.
Oh, okay, shit. So, and let me also ask you, what's your ethnicity? Because you look like
I'm black.
Okay. Yeah.
I'm Blackanese.
Oh,
I'm
shit.
half black and half Japanese.
It was either a doctor or a golfer. Got it.
That's an interesting combo.
Yeah. So your mother's black or your father's black? Or what's the...
You're asking me which half is black?
Yeah.
The waist down. The waist down is black. And I'm just kidding.
I walked into that.
I heard that already.
I walked into that one.
Yeah.
Good joke.
That's my go-to.
Yeah. But
my mom is Japanese.
Oh, she's Japanese. Oh shit.
Yeah,
okay. So I'm just curious, more so just like, did your mom bring you up like, Japanese in some structures? Like I imagine that, because I feel like a mother is like more structured.
You speak Japanese, no?
ちょっと話してる.
A little bit.
A little bit. Yeah.
I know Chota. I've been to Japan before, so.
Oh, that's cool.
Oh,
yeah,
beautiful.
I like hentai too much, so yeah, that's why.
You get the manga straight from
Japan. Yeah. Don't open that book. You can't, anyways.
It's all glued together.
First page to last, But yeah, I'm kind of curious as far as, though, more so just like, obviously you've achieved so much. So what do you look towards in the next, in your future?
Expanding the business, right? And so right now I'm in a growth phase. And so putting my name out there, putting the brand out there. I also got a lot of other projects on the side. I'm creating this device with this Polish company, actually.
Hey.
Shout out to Poland. There's some remarkable engineers and smart people out there, but we're creating this device which is going to standardize the way we take our before and afters, because before and after photography is one of the things that are super inconsistent amongst plastic surgeons, and also can affect how patients perceive our results.
Ooh.
What do I mean by that? Like, if I take a before photo, and it's in poor lighting with me all the way zoomed in where the camera starts to distort because of the lens and stuff, and then I take the after photo, super well lit, perfectly framed and everything like that, people are going to naturally think that the after photo is a better result just from the photography itself, not necessarily because of the merits of the surgery. Right. And so we're coming up with this device. It's super cool. It's called the Lucia Cosmetic photography device. It looks like a big phone booth where patients can stand in. It's got a motorized stand with like motorized cameras and everything. Super cool. We're actually going to unveil it at the Plastic Surgery, the meeting, which is happening at the end of this month. So I'm flying out to San Diego with the prototype device from Poland. And we're going to demonstrate it and stuff. But I've been doing, I have a prototype here in Miami that we've been shooting pictures and everything. And I don't know, I think it's going to change the game. So you guys stay tuned to really see this, because we're hoping to become like the gold standard of how photography is taken. So super dope.
Love that. So exciting.
But so 2 years from now, I want the machine to be popping off. I think it wants to be in full production and going into plastic surgery offices. I want my business to be expanding. We're trying to like franchise the name out eventually, where we become the premier location for high-end luxury plastic surgery, and try to replicate our results as we open up new locations. And so that's eventually the long play. But we obviously got to work up to that. So
And
It's
then,
gonna happen.
yeah, well, what about
yeah.
family and all that? How would you balance that all into that? Do you want kids? Do you want a wife, husband? I don't know, whatever you want. You can have it. I'm sure you can. Like, so,
Especially in Miami, I feel like.
Well, so that's that's a whole nother discussion. But as far as my personal, yeah, I do want to have a family. I do want to have a wife and kids eventually. But right now is like the growth phase of my business. You got to remember that, like, for us plastic surgeons, we've been in training my entire like career, right? I've only been out for a couple of years now. And so for me to juggle the family side and all of the other things on top of building the business, it's just a lot for me personally. And so I'm going to be the old guy on the soccer field, where I'm going to probably have a younger wife and, be like, oh, it's nice that you brought your granddad out here. And it's like, no, that's my dad, I'll probably be that guy.
yeah.
But for me, I want to be present in my kid's life, and I don't want to just have a kid that the mom raises. Like, I want to be an actual present in my kid's life, and so I'm just kind of holding off for now. Now, within the next 5-10 years, absolutely, I hope that that's crossed off, but it's just not in my immediate future, I would say.
Understood.
That's very responsible.
Yes, it is. You shouldn't just be having kids and
No.
leaving them.
Yeah.
You know?
And it's a lot for a
Yeah.
mom to raise kids alone,
Is it? I didn't know that.
I mean, I don't know because I don't have kids, but I was an au pair at one point and I've seen it. So it's a lot of pressure. Then, yeah, you're better off just doing it in a smart way.
True. But Dr. Mike, I want to thank you for your time. I want to thank you for joining us and giving us all this knowledge, and hopefully, like,
This was awesome.
yeah, like I'm sure somebody that's looking into this is really going to take hold of it and understand, the only doctor that they should go to and fly to.
Heck yeah.
Absolutely.
Oh, I appreciate the endorsement. Thank you guys so much for having me on. I love what you guys are doing. You guys have an amazing show, and I can't wait to see what else you guys come up with. So.
Oh, well, I mean,
Thanks.
we'll probably invite you back for round 2,
Yeah, 2 years from now.
No,
how's
not 2 years. Yeah, 1 year from now, because he's gonna be a billionaire by then.
Yeah,
It's like,
with
we
the
need you
machine
on the
for
show.
sure.
He's gonna be wiping tears with $100 bills. Like, like it was
Well,
so
he
tough.
has a great mindset, and it's gonna happen. So
Doc.
Well, thank you guys. I appreciate
Oh,
it.
of course. Do you want to just shout out your handles and stuff like that, where people can find you and your business as well?
Absolutely. For sure. So you guys can find me. I'm located in Miami, Florida. We have a beautiful practice on Sunset Drive. If you guys want to look me up, you can find me at Dr. Keys on Instagram or across all social media platforms. And my business is Celebrity Plastics. You can go to www.celebrityplastics.com. You can request a consultation with me, and I'm happy to address any questions that you can have about plastic surgery, fillers, med spa stuff. I do it all. And so I'm looking forward to speaking with you. So
yay,
tap
that's
in,
beautiful.
tap in.
Yeah, he's so
He's
far
good.
the best one that gave
Yeah.
us the handles off
He's
the bat.
on it.
Off
He's
the
on
rip,
it.
just perfect.
He's a businessman. He knows. He
He's
needs
a professional.
Yeah, he needs his
I'm
handles
a
ready.
business man.
Yes, he did it better than I did. I love it. I love it.
Too.
So, guys, thank you for joining us again at PND with me, Darylus.
Paulina,
So it's D&P now. All right, cool.
we can run that for a while.
No, we're keeping PND. It's fine.
Okay,
It's fine. It's fine. But just make sure to follow us, like us, subscribe for more, or else. Anyways, I think I messed that up. It's fine. It's fine. So, yeah.
But
So,
stay tuned for more, you guys. We're gonna have more interesting guests coming in.
yeah.
So
Yeah.
very exciting. But other than that, thanks.
Peace.